Outside the womb. Understanding and managing ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy occurs when a fertilized egg implants and grows outside the uterus, usually in one of the fallopian tubes, but it can also occur in other locations such as the ovary, cervix, or abdominal cavity. Unfortunately, an ectopic pregnancy cannot be successful, and it can pose serious risks to a woman's health. The most common cause of ectopic pregnancy is damage to the fallopian tubes, which can occur due to inflammation, scarring, or blockage caused by conditions such as pelvic inflammatory disease, PID, previous surgery, or endometriosis. Women who have had previous ectopic pregnancies or who have undergone fertility treatments like in vitro fertilization, IVF, are also at a higher risk of ectopic pregnancy. Ectopic pregnancy causes. The exact cause of ectopic pregnancy is not always clear, but there are several factors that can increase a woman's risk. These include previous ectopic pregnancy. Women who have had an ectopic pregnancy in the past are at a higher risk of having another one. Pelvic inflammatory disease (PID). This is an infection of the reproductive organs, usually caused by sexually transmitted infections (STIs) like chlamydia and gonorrhea. Previous surgery in the pelvic area. Surgery on the fallopian tubes, ovaries, or uterus can increase the risk of ectopic pregnancy. Endometriosis. This is a condition where the tissue that lines the uterus grows outside of it and can affect the function of the fallopian tubes. Use of assisted reproductive technologies (ART). Women who undergo fertility treatments like in vitro fertilization (IVF) are at a higher risk of ectopic pregnancy. Smoking. Smoking cigarettes can damage the fallopian tubes and increase the risk of ectopic pregnancy. Age. Women over the age of 35 are at a higher risk of ectopic pregnancy. Ectopic pregnancy symptoms. The symptoms of ectopic pregnancy can vary, and in some cases, women may not experience any symptoms at all. However, if symptoms do occur, they typically include the following: abdominal pain. The most common symptom of ectopic pregnancy is pain in the lower abdomen or pelvic region. The pain may be sharp or cramping and can range in intensity from mild to severe. Vaginal bleeding. Some women may experience light vaginal bleeding or spotting, which can be mistaken for a normal period. Shoulder pain. In rare cases, women with ectopic pregnancy may experience shoulder pain, which can be caused by blood from the fallopian tube irritating the diaphragm. Weakness, dizziness or fainting. These symptoms can be caused by internal bleeding. Nausea and vomiting. Some women with ectopic pregnancy may experience nausea and vomiting. Pain during intercourse. Some women may experience pain during intercourse, especially if the ectopic pregnancy is located in the cervix. Ectopic pregnancy diagnosis. The following are some of the most common diagnostic tests used to diagnose ectopic pregnancy. Medical history. The healthcare provider will ask about any symptoms you may be experiencing, your menstrual cycle, and any past pregnancies. Physical examination. The healthcare provider will perform a pelvic exam to check for any signs of tenderness or pain in the reproductive organs. Pregnancy test. A pregnancy test will be performed to confirm that you are pregnant. However, a positive pregnancy test alone does not confirm an ectopic pregnancy. Transvaginal ultrasound. An ultrasound is a common imaging test used to diagnose ectopic pregnancy. A transvaginal ultrasound involves inserting a small, wand-like device into the vagina to obtain images of the uterus and fallopian tubes. Blood tests. Blood tests may be performed to measure the levels of the hormone human chorionic gonadotropin (HCG) in the blood. In ectopic pregnancy, HCG levels may be lower than expected for the stage of pregnancy. In some cases, laparoscopy may be necessary to confirm the diagnosis of ectopic pregnancy. Laparoscopy is a minimally invasive surgical procedure that involves making a small incision in the abdomen and inserting a thin, lighted tube to visualize the reproductive organs. Ectopic pregnancy treatment. Ectopic pregnancy is a medical emergency and requires prompt treatment to prevent serious complications. The treatment for ectopic pregnancy depends on the size and location of the pregnancy, as well as the woman's overall health. The following are the most common treatments for ectopic pregnancy. Medication. If the ectopic pregnancy is small and has not ruptured, medication may be used to stop the growth of the pregnancy and dissolve the tissue. The most common medication used is methotrexate, which is given by injection. Surgery. If the ectopic pregnancy has ruptured or is too large to be treated with medication, surgery may be necessary. The most common surgery is laparoscopic surgery, where a small incision is made in the abdomen to remove the ectopic pregnancy. In some cases, a larger incision may be necessary. Observation. In some cases, the ectopic pregnancy may be small and not growing, and the woman may not have any symptoms. In these cases, the doctor may monitor the pregnancy closely and wait for it to resolve on its own. After treatment, it is important to follow up with your healthcare provider to ensure that the ectopic pregnancy has been completely treated and to monitor your overall health. Women who have had an ectopic pregnancy may have an increased risk of having another one in the future. Thanks for watching. Please do like, subscribe and click bell icon for more health videos. Also let us know how would you want us to improvise videos or which health condition would you like to explore in comment section.